Muscles in hand, thenar muscles, hypothenar muscles, thenar muscles, flexor pollicis brevis, abductor pollicis brevis, opponens pollicis, hypothenar muscles, flexor digiti minimi, abductor digiti minimi, opponens digiti minimi. Adductor pollicis is not thenar muscle and is supplied by ulnar nerve. Tendons of flexor digitorum profundus attached to the base of digital phalanx for interphalangeal flexion at DIP. They give attachment to lumbricals laterally. Lumbricals, they flex the MCP joints. They insert into dorsal distal expansion of extensor digitorum and helps in interphalangeal extension. Lumbricals 1 and 2 are unipennate muscles supplied by median nerve. Lumbricals 3 4 are bipennate muscles, more powerful, supplied by ulnar nerve. Important information: lumbricals and interosseae work together for MCP flexion, IP extension. Interosseae, mnemonic PAD or DAB. Palmar interosseae causes adduction of fingers. Dorsal interosseae causes abduction of fingers. PAD, DAB. Middle finger has no palmar interosseae. Middle finger has two dorsal interosseae. All palmar interosseae are unipinnate. All dorsal interosseae are bipinnate. To check for palmar interosseae, cord test. Hold cord between fingers and try to pull the cord out. To check for dorsal interosseae, spread the fingers, put resistance, ask the patient to spread them. Spread the fingers, put resistance, and ask the patient to spread them. Development: axis artery for upper limb is called as anterior interosseous artery. Preaxial bone, preaxial artery, preaxial vein. Preaxial bone, radial bone. Preaxial artery, radial artery. Preaxial vein, cephalic vein. Postaxial bone, ulnar bone. Postaxial artery, ulnar artery. Postaxial vein, basilic vein. Arterial supply of upper limb. Subclavian artery in the neck passes outer border of first rib, enters axilla and becomes axillary artery, which further crosses lower border of teres major to become brachial artery. Brachial artery, when reaches cubital fossa, divides into radial and ulnar artery. Ulnar artery enters palm to form superficial palmar arch. Radial artery enters palm to form deep palmar arch. Anastomosis between superficial and deep palmar arches can be checked via Allen's test. Anastomosis between superficial and deep palmar arches can be checked via Allen's test. Axillary artery. Pectoralis minor divides the axillary artery into three parts. First part give first one branch, second part give two branches, third part give three branches. First part gives superficial thoracic artery. Second part branches thoracoacromial artery, lateral thoracic artery. Third part branches anterior circumflex humeral artery, posterior circumflex humeral artery. Subscapular artery participate in subscapular anastomosis, also supplies the mammary gland. Superior thoracic artery supplies mammary gland. It does not participate in scapular anastomosis. Acha and PCHA, ACHA and PCHA anastomosis at surgical neck of humerus. Mammary gland. It is a highly vascular structure supplied by branches of internal thoracic artery, superior thoracic artery, acromiothoracic artery, lateral thoracic artery, subscapular artery, posterior intercostal artery, branch of descending thoracic aorta. Scapular anastomosis. Subclavian artery can be blocked in case of presence of cervical rib and causes upper limb ischemia. Therefore, to avoid this, there is anastomosis between branches of subclavian artery and axillary artery. Scapular anastomosis is formed by subscapular artery, circumflex scapular artery, dorsal scapular artery, suprascapular artery. Subscapular artery and circumflex scapular artery are branches of third part of axillary artery. Dorsal scapular artery and suprascapular artery are branches of proximal part of subclavian artery. In case there is block in distal part of subclavian artery, upper limb ischemia can be avoided because of this anastomosis. Venous drainage. Deep veins, radial vein and ulnar vein join to form brachial vein, which continues as axillary vein, which then further continues as subclavian vein. Subclavian vein is joined by internal jugular vein to form brachiocephalic vein, which on either side comes to form superior vena cava, which finally drains into right atrium of heart. Superficial veins. Dorsal venous arch, cephalic vein, basilic vein. Communication between basilic vein and cephalic vein is median cubital vein. It is the mostly used for taking venous blood sampling for doing blood transfusion. Blood flow of median cubital vein is towards basilic vein. It lies on roof of cubital fossa. Cephalic vein lies at roof of anatomical snuff box. Cephalic vein drains into axillary vein in axilla after piercing clavipectoral fascia. Cephalic vein lies at the roof of anatomical snuff box. Cephalic vein drains into axillary vein in axilla after piercing clavipectoral fascia.